wanted to talk to you today about neck lift and tell you about who's a good candidate for the neck lift. There's multiple options that we have for somebody who wants some enhancement or improvement for their neck. Part of this has to do with your age, with the degree of skin laxity, and also the characteristic of the fat in your chin. So people who have more fat in their chin or have more loosening of skin should get different procedures. For the most part, for somebody who has really good elastic skin, may have some more fat underneath their chin, liposuction with some sort of a skin tightening procedure like J-plasma works very well. For somebody who's got more loosening of the skin in the lower neck, potentially may have those bands that you can see in some people underneath the neck, that person requires what we call a platysmoplasty, where we actually not only do the liposuction, but we also go through an incision underneath the chin and we try to fix the muscles together. We actually remove some fat. Sometimes there's some deeper fat that we have to remove. So that's sort of like the second stage of what we would have to do for somebody who's got maybe a little bit of a looser skin and muscle. And finally, ultimately, for people who have really big hanging neck or have or maybe a little bit older, their skin doesn't have the same ability to retract and shrink up after doing a less invasive procedure, what we would have to do is an actual neck lift, where we make an incision around the ear. It's not all the way around, but usually around the ear and behind it goes a little bit behind the ear. And through that, and again, an incision down here, we go ahead and fix the muscles. Now we really suspend the neck from behind the ears, and now we can really, in a very good way, form the line that we call the cervical-mandibular angle, which is the angle between our neck and the chin, which a lot of times is lost as the tissue becomes loose. We're able to restore that. And again, in all of these, we usually ask you to do some compression afterwards using a special type of neck garment, which does that for us, and it's very easy to use.